Let's discuss diagnosis according to 8 principles. Excess cold part 3. We have here the table, the differences between the interior and exterior cold. For the interior cold, there is no headache, while in the exterior cold, there is acute headache. There is pain in full organ in interior cold, while in exterior cold, there is skin and muscle joint aches. There is disruption of a full organ function in interior cold, while in exterior cold, no disturbance of the internal organs function. For the interior cold, it is attracted to warm, while exterior cold, aversion to cold and wind. There is normal perspiration in interior cold, while exterior cold, lack of perspiration. There's a bluish finger and toes in the interior cold, while exterior cold, there is normal colored finger and toes. There's no fever in the interior cold, while in the exterior cold, possibly a slight fever or fever sensation. For the interior cold, there's a deep pulse, while exterior cold, superficial pulse. There's a pale or bluish tongue with thick white moist coating for the interior cold. And for the exterior cold, the tongue is usually unchanged. For the treatment principles in the interior cold, we need to warm the interior, while for the exterior cold, the treatment principle is to expel cold from the exterior. Treatment principle, if there is interior excess cold, expel cold, warm the interior. If there is exterior excess cold, open to the exterior, expel wind cold. Acupuncture points. Point selection will depend on which organ or channel had been invaded by cold. If there is invasion of wind cold, Tayang stage, choose from SI3, UB62, UB10, DO14, DO16, GB20, LI4, Lung 7, UB12, and UB13. If there's cold, B syndrome, choose from LI4, DO14, local and distal channel points, ASHI points. If there's stomach cold, choose from REN12, REN8, stomach 21, stomach 34, and stomach 36. If there's large intestine cold, choose from stomach 25, stomach 37, stomach 28, REN6, and REN8. If there's small intestine cold, choose from stomach 25, stomach 39, stomach 28, REN6, and REN8. If there's cold uterus, choose from REN4, kidney 12, kidney 13, stomach 30, and UB32. Needle technique, draining, moxa is recommended. Relevant advice, a person who has been invaded by exogenous cold will benefit from drinking hot ginger tea, a decoction of garlic or hot whiskey with spices. If they have interior cold, they can use cinnamon in their diet, drink ginger tea, and use warming spices, as well as avoiding food and beverages that are energetically and physically cold. For the differences, we have here the differences between deficient and excess cold. There is symptoms. The symptoms are usually chronic for the deficient cold. For the excess cold, the symptoms are often acute. The person freezes, but if they put on enough clothing or lie under a kilt, they can keep warm for the deficient cold. And for the excess cold, the person freezes and cannot get warm even if they put on enough clothes and blanket. There's dull and pale facial color for the deficient cold. And for the excess cold, shiny white facial color. There's a milder symptoms for deficient cold, and there is a stronger symptom for excess cold. There's dull pain that is alleviated by pressure for the deficient cold, and for the excess cold, biting or cramping pain that is aggravated by pressure. For the deficient cold, if there is diarrhea or constipation, any discomfort or pain is not alleviated by passing of stools. While in excess cold, if there is diarrhea or constipation, any discomfort or pain is alleviated by passing of stool. There's a weak, deep, and slow pulse for the deficient cold, For the excess cold, there is full, tight, deep, confined, and slow pulse. There's thin white tongue coating for the deficient cold. For excess cold, there is thick white tongue coating. For the treatment principle, we have to warm the young for the deficient cold, and for the excess cold, the treatment principle is to expel cold, warm the interior. Thank you for your attention.